Hello everyone. Today we'll be talking about dengue, the dengue fever, which is also known as the bone break fever. Recently, we are having an outbreak of dengue in Nepal, and since it is a outbreak, it is my duty to make you some education about the dengue fever. This is mainly will be targeted to the educated and the doctors, and I'll try to make in a local language in next video. Okay, so my name is Dr. Ranjit Sah. I'm an infectious disease specialist, and this is important for me because I myself has suffered from dengue previous year. So I know not only by knowledge but by experience as well. Okay, so let's begin. The dengue fever, also known as the bone break fever. What is known as the bone break fever? Because it has got high fever. Okay, and the bone break describes the disease because the patient will develop bone pain. There will be a bone pain, there will be the muscle pain, joint pain. Okay, there will be high fever, severe headache, pain behind the eyes, then is a retroorbital pain, muscle and joint pain, nausea, vomiting, swollen gland, and rash. The name is bone break because there is a bone pain as well with high fever. Okay, before going into the what are the detail of it, let me explain you how this occurred and why the outbreak is going on. Look, the dengue fever is normally called the disease of urban area where there is an artificial collection of water. Before going into that, let me tell you what this dengue fever is due to a virus. And you know that every virus has a cycle and it comes and goes away from the body. Okay, so when you talk about the virus, this is solely the viral disease that you have to understand first thing. The virus is spherical virus, that is a single stranded RNA virus, and there are actually 4 serotypes that has been confirmed: DEN 1, DEN 2, DEN 3 and DEN 4. There is a proposal of another serotype called DEN 5, which is not confirmed but it is under investigation, and I myself is also involved in dengue virus research. Okay, since the 4 serotype, look, so 4 serotype, why you need the serotype? Because when you are going to have an infection first time, you will have an infection with one serotype. If you are getting infected with one serotype, then it will come into your body, it will cause the symptom, and I will explain you what are the symptoms, how it goes, and then you get recovered. But when you are going to have a next time, and if it is the same serotype, you will be protected. But if it is going to be due to another serotype, then disease is actually aggravated. There will be antibody dependent enhancement because the disease in that situation disease will actually aggravate it. Means if your first time you are getting infection, the disease condition, suppose say it is 50%, when you will get second time virus infection, then it will goes to 90%. Means severity increases when you get second time with another serotype. And because of that, you need to understand which serotype is prevalent in your country, in your area, and is there more serotype prevalent, then all are risks to have severe dengue. That is important. In our country, DEN 1, DEN 2, DEN 3 and DEN 4, DEN 2 and DEN 4, that is the even one, are actually 40% prevalent, whereas DEN 1 and DEN 3 are 10%. So they all mean 100%. Now you have to, why this disease is important? Disease is important because there is no treatment. Like HIV, other viral disease, we have some antiviral drug for treatment. But this disease doesn't have any treatment. The only treatment is supportive measures. The doctor, the expert like us, if you come to us, we will manage you symptomatically only because we don't have the cure. Second point is there is no vaccination. Although some of the vaccination trial is going on, some have been approved by the WHO, but I think the vaccination is not well familiar and well established, because I told you that if you are getting infection with one serotype, and if you are first time, then the chance of survival is 100% all the most time. But when you are getting second time infection, the chance of death increases. And because your immune gets sensitized to it, and if your immune get once sensitized, if you are getting second time, then risk is very severe and you may need to go to ICU. So that you need to understand. And if vaccination sensitize your immune, then that may lead to the first time your severity will be increased. So there is a lot of discussion going on about this, and we'll know we'll come to know what will be the vaccine available in Nepal or not. Okay. Then coming to the virus, we know about it. Now this virus doesn't going to cause you an infection. Okay, it needs a transporter, it needs a vector that will transmit to the human. It doesn't get directly from the environment, and because of that you need to understand it is not going to transfer by touching the patient, by hugging them, by sitting with them. That is not. Only the mosquito is the player. If anybody is sick in your home, and if mosquito is not biting that family member, and that mosquito again biting to you, then you are not getting this infection. The mosquito is a player that will come into the play and transfer the disease. There is no way to transfer the infection. So mosquito is a culprit, and this mosquito is very unique because this mosquito is known as the Aedes mosquito. They are you can see the black mosquito with a white streak, and this appearance is known as the tiger appearance, and so it is known as the tiger mosquito. Okay. Now talking about the mosquitoes, there are two species, Aedes aegypti and Aedes albopictus. These two are the daytime feeder. Means what? The mosquito which are going to bite you during the day are only the dengue mosquito. Only the mosquito they can transmit your virus are mostly bite during the day. So daytime mosquito biting, so you need to be serious. You need to prevent yourself from biting a mosquito from daytime for preventing dengue. Okay, now coming to the daytime fever, you have this mainly in the early morning and evening before the dusk, means sunrise and sunset. These two are the main prevalent peak time to bite this mosquito. Why this mosquito bites the human? Actually, you need to understand it. Look, male mosquito usually feed on fruit juices, plant juices. Female also feed on plant juices. But the problem is that when they get pregnant and they have to lay eggs, during that they need the extra blood, and for that extra blood what they do, they suck the blood. They get extra nutrition from the blood of the human to lay the eggs, to reproduce, to run the cycle of reproduction. Otherwise they are not going to bite you unless they require the egg laying. Okay, so for that they need extra nutrition, and for that they are going to bite you. So female mosquito is very dangerous in this case. Okay, and now we are talking about that this Aedes aegypti, which is a daytime fever, daytime feeders. Now there is another, this mosquito, normally we think that these are the hot climates. These are the mosquitoes are mainly found in the hot region, the tropical region. Okay, so they are the disease of only the tropic region. But now we are having in Kathmandu also. So why it is? It is due to the another species called Aedes albopictus, and that is very important because this albopictus is have a very unique character of adaptation. So if a mosquito that is present inside the Tarai bed and that come to the Kathmandu through the bus or any way, now it has a capacity to adapt to the environment, and it can even breed, it can even survive in the low temperature. Okay, and because of that, this Aedes albopictus has found to be very prevalent in Kathmandu to cause this outbreak. Although we are having outbreak all over the country, but this albopictus, Aedes albopictus, is more responsible for the cold region, and you have to be aware all over the world that even in a cold countries we can't have this dengue virus infection, and you need to be very clear about it. Okay, so you are not, even you are living in Kathmandu or any in Jumla or any high altitude, this mosquito if get transported over there, they can cause the disease. They can carry the virus and they can cause the disease. One important thing I will mention here is the mosquito egg that are present. Actually, look, mosquito where it will breed. It is the urban area disease in the artificial collection of water, mainly during the rainy season. Now rainy season is going in Nepal, and the problem is that the water collected outside, this virus breed fast. Because of this is the peak reason to have dengue outbreak, and we are having it. Okay, so you have understood about so what is the prevention? The only treatment, the only thing to prevent this disease is to eliminate this vector. For elimination, you can kill all the mosquito, which seems to be impossible. So all the places where it can breed, artificial collection of water, you can bury the artificial collection of water or cover it or make it such a way, or use insecticide or apply the kerosene oil over your water so that this egg doesn't survive. Because if you are these eggs are very resistant. It can survive up to 1 year, and even when it comes into the water, then again breed out. So in endemic region, the eggs, if you are not been killed, then in next year they are, and the problem is they can transmit the virus transovariant. So one infection mosquito is infected, they can transmit to their babies as well, and their babies are also now dengue infected. And if anyone getting bite you, dengue. Understanding my point? So these are important for you to understand all the dengue whole picture. Okay. Now coming to the human, this has bite the human. Now the human has got the infection. The patient, how the infection will occur? Look, the incubation period is 4 to 10 days. What does that mean? That means that when a mosquito bite you, after a bite, the 4 to 10 days will take to develop the symptom. Okay, so 4 to 10 days is a incubation period. Incubation period is 4 to 10 days, and symptoms last for 2 to 7 days. Means once you have started the fever, then your symptom will last for 2 to 7 days, and we'll talk about it. So what are the symptoms you have? You will have a high fever, severe headache, pain behind the eyes, muscle and joint point pain, nausea, vomiting, swollen gland, and rashes. So these are the findings, these are the features you will present. So you need to understand, if you are having high fever, you are having pain in the around the eyes, if there is a headache, you are having muscle pain, joint pain, then you have to suspect, oh, I might have dengue, so I need to get checked. Okay, so what are the stages now? Let's go to the stages, how it will behave. The stages of dengue fever are febrile, critical, and recovery. So what is meant by febrile? The febrile period stage is that it is the stage where you will have a high grade fever. Imagine you will have a severe high grade fever. You can die. Even I have a dengue, so I know that there is a high grade fever, and you feel very lethargic, very weakness. Okay, that is the first fever, high grade fever, and that lasts for 2 to 7 days. In my case, it was last for 5 days. Okay, so 2 to 7 days is the average period, and rash will appear 2 to 5 days after the onset of fever. So in my case, it was on the 4th day, if I remember correctly. So you will have 2 to 5 days after the fever peak, there will be appearance of your rashes all over your body. Okay, then when the fever goes away, then it becomes the critical phase arises. So you can take as the 2 to 7 days of your febrile, take as 5 days febrile, you will have high grade fever all the spring. But this is not the critical phase. This is not the phase where you are going to die. But after the fever goes off, after the fever goes down, which is known as the defervescence, then critical phase arises. And in critical phase, this lasts for 24 to 48 hours, and that is very critical because in that phase you may die. Why? Because the vascular leak syndrome occurs, characterized by the plasma leakage, bleeding, shock, and organ impairment, and severe thrombocytopenia. So critical phase is very important, and which occurs after the fever. You say, okay, I'm relief of the fever, now I am fine. No, after the fever goes away, now comes the critical phase, and that is 24 to 48 hours, and that is very critical time. If that phase you pass, means you are survived. You are now okay, fine. Then comes the recovery phase. And why this is critical? Because this time you will have the vascular leakage. Your vascular leak syndrome will come. There will be the plasma leak from your vascular permeability will increase. Your plasma will leak. You will have a bleeding from all over your body. Okay, you may have hematemesis, melena. Okay, gum bleeding. Lot of bleeding can happen. Even you can go in the shock and organ impairment. Okay. And then if you survive this stage, then you come to the recovery phase, which is known as the convalescent phase. There is plasma leak and hemorrhage will be resolved, and additional rash may appear at this stage. Okay. Now coming, you have understood the fever phase, the critical phase, and the recovery phase. Okay, how we understand the critical phase after the fever goes away, and what will be the finding? Plasma leak, bleeding, then maybe you will have vomiting of the blood, you have melena, black color stool. Okay. Then you have a fluid collection in your lungs, in your abdomen. These are the leakage, evidence of your plasma leak. That is the critical phase, where you can go into the shock. And since there is a plasma leakage, okay, now your permeability has increased. Now you can apply water, IV fluid, saline. The more water will go into the third space, and more. This is why critical phase. You are saying that okay, water loss from the body. What does it mean? You can supplement. No. At that time, if you give IV water, then what happens? This more water will leak into the throat space, and there will be more fluid in the lung, more fluid in the abdomen. That is very critical of this disease, that you have to understand very clearly. Any patient, okay, if he can take water, please prefer plain water through mouth. Okay, if he is not going to take through the mouth, he has got unconsciousness, then only please think for IV fluid. Okay, if he or she can take water, even you are giving IV fluid, the IV fluid should be less and water should be more. That you have to understand. That is a very important thing, what my experience is when I got infected with dengue. Okay, now coming to the cardinal feature. You know the cardinal feature of your dengue will be fever, that you know. There will be the leukopenia, means the WBC count will come down, but that is not the main issue. The main issue is thrombocytopenia, which is a cardinal issue. You will have a severe thrombocytopenia. Okay, even my platelet count has gone to the 5,000. So that is you need to understand. Increase in EST count, positive tourniquet test, and increased vascular probability. So these are the cardinal feature. And among one, I need to make you understand that positive tourniquet test means if you apply the blood pressure measuring cuff midway between the systolic and diastolic, and after 5 minutes you will find the petechiae below that. If you apply here, then petechiae will be appear here. In 1 inch, if you are finding 10 petechiae, then it is dengue. Do you understand what I want to tell you? Now, WHO has classified the two way. The one classification was in 1997, saying that there was 3 classifications: dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. Where in 2009 it has revised and come into the dengue without warning sign, dengue with warning sign, and severe dengue. This is actually same, but you need to understand this thing. Okay, and I will explain while managing the patient. That will be better. Okay. Only thing is that here you will have dengue fever, means you are going to have a fever. Hemorrhagic fever means you are now having the bleeding tendency, plasma leak, and shock means patient is in the shock. Okay. Same with dengue without warning signs. There is no much warning sign. Only fever, headache, myalgia, pain is there. Warning sign, dengue with warning sign is there now: abdominal tenderness, fluid in the lung, ascites. Okay, severe abdominal pain, severe vomiting, plasma leak. Okay, hemorrhagic tendency. Then this is a dengue with warning sign. And severe dengue means shock, organ failure. Okay, so this has been revised. Lot of people, I have seen lot of publication recently going on that they are describing only 1997. Now it has been revised by the WHO and we into this three: dengue without warning sign, dengue with warning sign, and severe dengue. Now my main point of concern is how to diagnose the dengue. That is important for you, for a doctor and other person. After the onset of the fever, when you are going to have 0 to 3 days, so you have having a fever, on 0 to 3 days, if you are going to do NS1 protein or RT-PCR, then it will be positive, but antibody will be, IgM will be negative. When it goes from the day of fever, it goes to the 3 to 7 days, then NS1 also will be positive. This is a non-structural antigen, and IgM both will be positive. But after 7 days, if you are measuring, then NS1 non-structural protein RT-PCR will be negative, but IgM will be positive. What I have to say that you need to understand where you are when you are testing the person. If you are testing from the onset of fever to 3 days, then you are going to find this NS1 protein only. And in my case, we are fine because I know I am a doctor and I have fever. I know that I am having something. I tested on 2nd day and I was positive for this only. There was no positive for IgM. It required some time. Actually, at 4th or 5th day, this IgM comes positive. So 3 to 7 days, you have NS1 also, IgM also. If greater than 7 days, this NS1 will be not be positive. It doesn't mean that you don't have the dengue. You have to test for IgM. So this needs to be very clearly understood to diagnose the person, and which is important for you. Okay. IgM is important. IgG can be demonstrated, that can indicate the antibody of the past, and this can help you to know that the severity may occur this time. Okay. So if you know this, then what will be the treatment? Treatment will be supporting measures. You have to give the antibiotics, maintain the fluid balance. Okay. And main important thing is there is no antiviral treatment, so prevention is better. Prevention, you have to eliminate this mosquito. Okay. So let's make this much only. We'll have a next lecture where we'll be explaining how to manage this dengue fever and what are the CDC guidelines, and that will be better. This is the overview to understand, to make you
a clear message that this is severe and we are having an outbreak and we need to control it. Thank you.